Hello, my name is Michelle Wynn. Today I will be demonstrating the subcutaneous injection. The supplies that I'll be using, I have gloves, I have my medication vial, I have my syringe, I have my gauze, I have my alcohol swabs, and I have my patient. I will begin by reviewing the doctor orders, verifying the six rights of medication administration, which is the right patient, the right drug, the right dose, the right time, the right route, and the right documentation. I will verify my patient's chart in the EHR, specifically looking at the MAR, and I will see what the doctor has ordered. And it looks like the doctor has ordered 1,000 units of heparin, which is supplied in 10,000 units in 10 milliliters. So my dose, after doing the calculation, would be 1 milliliter, which is 1,000 units. So I will gather my supplies. I will proceed to my patient's room. I will knock before entering. I will close the door behind me to ensure patient privacy. I will sit my supplies down on a clean, dry, flat surface, and I will perform hand hygiene and proceed with my patient. Hello, sir. My name is Michelle. I will be your nurse today. Can I please verify your first and last name and your date of birth, please? Thank you for that information. I have verified that information with the wristband, and I will use this opportunity again to check my medication and the MAR to make sure that everything matches up. Mr. Jones, do you have any allergies, any food, medicine, or environmental allergies? Okay, perfect. So today your doctor has ordered a heparin injection, which is an anticoagulant or a blood thinner, and is used to prevent blood clots or from making them bigger. Heparin interferes with certain factors that activate thrombin, which is an enzyme that helps blood clot. And heparin works by decreasing the clotting ability of your blood and is used for various conditions. For your case, it's used for your DVT, the deep vein thrombosis. So, some of the side effects of this injection is you may experience injection site pain, easy bleeding or bruising. Some of the more adverse effects are dizziness, shortness of breath, severe headache, or blood in your urine or stools. Now, Mr. Jones, if you experience any of those, it's important to notify us immediately, okay? Okay, and while administering this injection, you most likely will feel slight burning or stinging sensation, but that's completely normal, okay? Do you have any questions for me, Mr. Jones? Okay, thank you. Okay, so now I will begin to prepare the medication. I will perform hand hygiene again and put on my gloves. Mr. Jones, just give me a moment, okay? I'm going to prepare the injection, okay? Okay, first I want to begin by checking my medication again. This will be my third time checking it, checking to make sure that it matches the MAR. And I will use my alcohol swab to clean the medication vial. I will get my needle. And for today, I am using the 1 milliliter syringe, 25 gauge and 5/8 inch needle. I'm using this because of the limited supplies that I was provided. I'm going to discard this. Okay, so first I will begin by putting in air, injecting air, and I'm going to get the same amount of air as the amount that I'll be withdrawing. So for this, it will be 1 milliliters of air have been applied. Okay, now I will remove the lid. We'll insert this in the medication vial. Then I will insert my air. I will invert the medication vial, and then I will withdraw the appropriate amount. Which is 1 milliliters. And it's important that if there's any air bubbles, you remove those, and you would remove those by tapping. Okay, and since I am not ready to administer this, I will use the swoop method to put the top on. I want to get this in view. And as you see, I have the correct dose, 1 milliliters of heparin. Okay. I'm going to move this out of the way. Okay, Mr. Jones, I am almost ready. Okay, so when administering heparin, it can be administered in the upper arms, it can be administered in the thighs or the abdomen area. For this particular patient, I will be administering it in the abdomen area. And typically in the abdomen area, you want to do it 2 centimeters to the right or left of the umbilicus or the belly button. So for my patient, this will be the appropriate area right in the middle. Okay. Okay, Mr. Jones, thank you for your patience while I got your medication injection ready. So now I am going to, I'm going to have to touch you. Is that okay? I just want to make sure that I have the appropriate location where I can do the injection. Is that okay? Okay, thank you. So I'm going to have to raise up your shirt. Okay. And when doing this, you just want to check the area for any skin discoloration, any bruising. You want to palpate for tenderness. Okay. So I don't see any of that. So this area looks like it's okay for me to use. Okay, Mr. Jones, I will begin the process. Okay. Do you have any questions or concerns? Okay. So when picking your needle, you want to just make sure like you pinch the area in which you're going to inject, and you want to make sure that the needle is half as long as the area that you'll be injecting. And for this, it is. For Mr. Jones, it is. Okay, so Mr. Jones, what I will be doing is I will pinch your skin, and then I will insert this injection, okay? Okay, so let me clean your area first. I just wanted to show you what I'll be doing. Okay, so when cleaning, you want to clean from the center outward. Okay, and then I'm going to dispose of this. You want to let that air dry. Okay, Now I am removing the top. You want to hold the needle with your fingers, and you want to hold the skin. You want to pinch the skin. Okay. And then you want to inject it at a 45 to 90-degree angle. And you want to inject it like it's a dart. Okay. Okay, so now that I have injected that, I am going to remove my non-dominant hand and place it here to stabilize this. And then I am going to use my dominant hand at the plunger part. And when injecting, you want to inject it slowly over like a 30-second time frame. And then you quickly want to withdraw and place a gauze on top. You want to dispose of this immediately in the sharps container. Okay, you just want to apply a little pressure. You don't want to massage it. Okay, and then you want to just inspect the area. There's no bleeding, so there's no bandage needed. So I'm going to dispose of this gauze. I will remove my gloves. Perform hand hygiene. I will ensure that my patient is in a comfortable position. Mr. Jones, I will be back to check on you, but I will go and document this procedure.